Today's video is about treating constipation. I ask almost every patient of mine, how is your bowel movements? Our gastrointestinal tract is very important not only for digestion and absorption of water, vitamins, minerals, nutrients. The gut also affects our immune function, the general health of the body, and even our mood and emotions. I have to remind you, if you have questions, worries, concerns about your health, please, first of all, consult your healthcare provider. Constipation might be caused by various factors both of functional and organic nature. When a doctor discovers an organic cause leads to constipation, they will prescribe a comprehensive treatment based on the individual characteristics of your body. If the disease is not detected, then constipation looks like a functional condition. So you can take certain steps to improve the state of your GI tract and overall health. The good news is that most types of constipation are functional. How exactly to treat constipation? In this video, I am talking about the principles of constipation treatment, and they are similar in children and adults. But within the framework of this video, it's impossible to cover all age restrictions, contraindications, and application features. Therefore, be sure to check with your doctor. Dehydration leads to drying of feces and the difficulty of passing them through the large intestine. It's favorable to drink in the morning on an empty stomach 1-2 glasses of pure still water or water with lemon or rosehip infusion. If you are practically healthy and your doctor has not limited your intake of water, then drinking about 20 to 30 milliliters per 1 kilo of your weight will benefit your health. If you have impaired renal function, atherosclerosis, heart disease with heart failure, etc., it's especially important to limit fluids up to 500 to 1000 milliliters per day. Be careful with mineral waters containing calcium salts. Such water has astringent and fixing effects. This is one of the reasons why most people begin to complain of constipation when they have changed their place of residence. Mineral waters containing sodium sulfate and magnesium sulfate could help well with constipation. They retain water in the GI tract, interfere with its absorption, irritate the gut wall, and increase bowel movements. For example, mineral water Zayachitska Horka and Donat Magnesium contain a high dose of magnesium which has a beneficial effect on the digestive tract. This is not an advertisement, this is advice. It's recommended to drink 100-200 milliliters of Zayachitska Horka water in the morning on an empty stomach or in the evening before bedtime. This water can be used for tubash, cleansing the gallbladder. Keep in mind, there are contraindications for taking this water. Water temperature also matters. If you have constipation, cramping, abdominal pain, sheep stool, increased gas formation, this is more likely a spastic constipation. Then you should use warm or hot mineral water. Mineral waters having a temperature from 20 to 35 degrees Celsius are considered warm, and from 35 to 55 degrees Celsius are considered hot. If constipation isn't accompanied with abdominal pain, the tone and peristalsis of the gut are reduced. This is seen by ultrasound examination. Then it looks like you have atonic constipation. It might be useful for you to drink cold mineral water, water with temperature about a little below 20 degrees Celsius. Nutrition or diet plays a very important role in the treatment of constipation, especially elementary constipation. Eat food with a lot of fiber, for example, whey-baked, not very sour black bread, cookies made from coarse flour, bran, preferably wheat. You need to take 2 tablespoons of unprocessed brown flakes daily. It is favorable to eat food that irritates the gut and improves bowel movements. These are sauerkraut, canned tomatoes, cucumbers, carrots, raw beets, spinach, zucchini, onions, radishes, peas, lentils, beans, as well as many fruits, especially grapes, tangerines, orange, figs, nuts. Fruits that moderately stimulate intestinal motility include apples and prunes. They can be used both in natural form and in the form of infusion. To prepare an infusion of prunes, you need to take 10 to 12 pieces of prunes, rinse them, pour boiling water in the amount of 1 glass, and leave for 5 to 6 hours. Drink such an infusion better at night. It's quite effective. Very effective against constipation is to consume kiwi fruit. You might be surprised, but it's better to eat kiwi fruit with the peel. This will provide you with beneficial nutrients such as folates, vitamin E, polyphenols, flavonoids, and fiber. Some companies produce kiwi extract capsules like Otamol Pro Basic Plus. Also could help water-rich fruits and berries, melons, peaches, plums, gooseberries, strawberries, dragon fruit, fresh tomatoes, pumpkin. Products that moderately irritate the intestines and increase peristalsis include yogurt, kefir, kumis, buttermilk, acidophilus milk. By the way, acidophilus milk is a milk which is fermented with acidophilus started culture, and it's suitable for people who cannot consume milk due to lactose intolerance. You need to take 1 tablespoon of liquid acidophilus 3 times a day. In chronic constipation, you could use butter, fish oil, and dishes made from olive oil, as well as spreads, sardines. Eat healthy, high-quality products, and of course take into account your individual tolerance and allergic manifestations. In the treatment of constipation, it's necessary to strictly limit astringent and delays GI motility. Cocoa, red wine, rice, white bread, chocolate, black coffee, strong tea, mealy and mucose soups, blueberries, lingonberries, cornel, semolina. Olive oil is taken as a laxative on an empty stomach in an amount of 50–100 grams, followed by 300 milliliters of mineral water. The purpose of castor oil is impractical because after loosening, it causes constipation. Rhubarb root radix ray in small doses causes constipation. In large doses, it increases the motility of the colon. It is used internally in powders, decoctions, both in pure form and in combination with other drugs. The action occurs in 8 to 10 hours. The Alexandrian leaf or senna leaf, Pholium senna, contains chrysophane acid. This acid increases the tone and motility of the colon. It is prescribed in the form of a cold infusion or a complex infusion of senna, Venice drink. The action occurs in 6 to 10 hours. Zoster buckthorn berries laxative is used as a decoction and infusion. Sugar kelp seaweed deserves attention as an anti-locking agent. It is collected in the White Sea at the depth of 10 meters off the island of Ghukasyan. It contains alginic acid which swells heavily in water. Dr. Dobrovensky wrote that with the appointment of sugary kelp, a gentle relaxing effect was observed in all his patients with constipation. Even with prolonged use, there were no side effects including diarrhea. Precautions for the use of enemas. It is undesirable to use enemas often. The sensitivity of the rectum decreases, addiction develops, and further independent defecation without enemas is almost impossible. Please do not use solutions that cause high intestinal irritation, such as soap solutions, soda, and highly concentrated salt solutions, 10% and higher. In patients with heart attack, cerebral hemorrhages, with hepatic and renal colic, it is highly undesirable to use strong laxatives and high siphon enemas. Sometimes for severe patients, a glycerin suppository, a small enema with warm water and vegetable oil at night will be enough. Microclysters are widespread. The increase in the amount of water due to peptization and liquefaction helps to soften feces and facilitates bowel movements. The laxative effects occurs 5 to 15 minutes after taking the medicine. Microclysters can be successfully used for acute constipation and in preparation for instrumental studies. One of the most effective and gentle means of combating constipation is glycerin suppositories. They have a slight irritation effect on the mucous membrane of the rectum, reflexively stimulate peristalsis, and help soften feces. Glycerin suppositories might be used by pregnant women and during breastfeeding. However, prolonged use could cause intestinal irritation and allergic reactions. They are contraindicated in the following conditions: hemorrhoids in the exacerbation phase, inflammatory diseases, and tumors of the rectum, hypersensitivity to glycerol. Physio, climate, and balneotherapy have been successfully used to treat chronic constipation for a long time, especially in disorders of the nervous system and psychological problems. However, these methods are prohibited in the presence of tumors and some diseases of the internal organs. Be sure to consult your doctor. Physio and balneotherapy can have a better effect than sedative and antispasmodic drugs. Among the physical methods of treatment, you can use gymnastics, exercise, and yoga. Physical activity increases the overall psychophysical tone of the body, improves the functions of the GI tract and blood circulation in the abdominal cavity, straightens the abdominal and skeletal muscles, massage of the abdomen. Mechanical irritation of the intestinal tract through massage has a beneficial effect on the restoration of peristalsis. The Soviet doctor of medicine Ghukasyan recommends doing your own abdominal massage every morning before getting out of bed when you lie on your back with outstretched legs. You breathe in simultaneously with the massaging movements of your hands, and you breathe out when your hands do not massage your belly. This abdominal massage should be performed clockwise and from top to bottom. Such a massage can be given to yourself as well as to your child, of course in the absence of serious diseases. An abnormal lifestyle, some habits, and pure parenting are important in the occurrence of chronic constipation. Children inhibit defecation themselves. They do not want to sit on the pot because of constraint, moods, fear of falling off the pot, fear of being left alone, because of the cold of the pot, the restroom, or both. Students often rush to school and do not make their toilet in the morning, and then at school they do not have enough time or desire to go to the toilet. Schools might not always be provided with enough isolated, clean toilets. Due to the large amount of work, meetings, and deadlines, office workers do not have time to go to the toilet. Constipation in women occurs often with disorders of the menstrual cycle, chronic inflammation of the genital area with psychological problems and shyness, and sometimes during pregnancy. The best treatment is prevention. Create favorable conditions for yourself, your family, and your children. Get up early in the morning to have enough time to go to the toilet. If the child has had a one-time constipation and now they are afraid to sit on the potty, calm them down. Explain the importance of daily bowel movements. At school, at work, try to choose a convenient time and a suitable toilet. Treat acute constipation in time because they often turn into chronic. Remember that daily suppression of the urge to defecate leads to constipation. Eat healthy, drink pure water, exercise, stay in a good mood, and you will not be afraid of constipation. Write in the comments below which methods you were interested in, which ones you tried. See you on my next video. Take care of your body, mind, and GI tract. Bye. or desire to go to the toilet. Schools might not. It's up to 500 to 1000 milliliters. Что? Что, мя, пошла? Иди.